Hi, everyone, and welcome back to the Faster Way podcast. I am thrilled to be here today with Dr. Austin Perlmutter. Austin, thank you so much for being with us.
Amanda, thanks for having me. Excited for the conversation.
Austin, I already introduced you, so my audience knows that you are a New York Times bestselling author. You received your medical degree from the University of Miami, so you were a neighbor of mine in Florida. But I want to hear from you when and why you decided to enter the wellness space. When and why did you become a doctor?
It's a good question. I think I had a little bit of a push as far as my background goes. My dad is a neurologist. His dad is a neurosurgeon or was a neurosurgeon. So lots of medicine in the family to start with. But I think it's important to make a distinction here between medicine and wellness. These are two spaces that have a lot of overlap in the Venn diagram, but aren't necessarily the same thing. And one of the realizations I had pretty early on in my life is that there's a huge difference between reactive medicine and wellness. Wellness tends to support upstream medicine. There were so many instances in my training, mostly in my conventional training, where I recognized that conventional medicine is amazing when things go really wrong. But I didn't want to be an ICU doctor. I didn't want to be an emergency medicine doctor. I wanted to do something to actually get to the biggest issues of the modern day, which are that chronic and largely preventable diseases are ravaging the United States and the planet. And more specifically, that these stem from issues with our brain function. Now, we'll get to why that, kind of all coalesced for me, but the fundamental understanding and the reason I'm doing what I'm doing now, and why I'm in the wellness space, is because the systems that we have in place right now to try to improve health, to protect health, do not work nearly well enough to get to the outcome we care about. And I look around, and I don't know what you think, Amanda, but what I see is so many people struggling with their brains. And when you struggle with your brain, yeah, of course you have poor mental health, but you also have worse memory. You have worse cognition. And because of that, you make unhealthy decisions. And when you make unhealthy decisions, you become trapped in a pattern of making unhealthy decisions. And this leads to the most common medical problems of our day. If you look at 7 out of 10, the most deadly conditions in the United States, these are chronic diseases caused largely by lifestyle. So getting to the root of that is something I'm so passionate about because I have seen firsthand in my family where I've lost 2 of my grandparents, my grandfathers, to Alzheimer's disease, in patients who perpetually came in with chronic preventable conditions, heart diseases, diabetes, that I absolutely knew we could do so much more for them, that the current system just isn't working. And so I knew I needed to do something else. And wellness provides that platform, that opportunity to be talking not just about disease prevention, but actually health creation. So that's where my passion came from. It's the simple delta of where we are and where we could be, and knowing that I could do something about it.
Yeah. There's so many different ways we could go with this conversation, and we are going to dive into the brain health component because that's not really something that we've zeroed in on through the Faster Way podcast before. But as someone who went to medical school, I want to hear a little bit more about your perspective because I'm not a conspiracy theorist, Austin. I'm absolutely not. But I do get very frustrated with the health care and medical system. However, I also am not convinced that doctors are trying to do the wrong thing or come from the wrong angle. It's almost more just so a limitation of their education or a limitation of the tools that they have at their disposal. Recently, I saw a person on Instagram sharing the most ridiculous content, like just absolutely false, wrong content saying, I'm a medical doctor, and as a medical doctor, I will tell you that the only thing that is proven to cause cancer is meat. Literally did not say anything about sugar, feeding disease, didn't say anything about all of the other toxins that we like, literally definitive statement. The only thing that causes cancer as a doctor, but it's like, I almost just had compassion on this person, even though I think they should be banned from Instagram. Like, I almost just had compassion because she can't do better. She like doesn't have the education or the tool. So, like, what's your perspective? You've been in that world and then you chose a particular path, but like, do
Right.
people go into the medical field genuinely to help people and then they're just like stuck in the system, or what happens?
Sure. Well, I just want to comment on that Instagram post. I think this is an instance in which people are pushed to say sensationalized stuff to gain traction.
That's true
I
too.
can't imagine. I mean, I know it's impossible. If you got an MD, that is not what you believe unless you've gone down some sort of weird side path and have your entire worldview colored by some statistic that you saw somewhere. Because we know, I mean, there's no doctor that I'm aware of who would say that cigarettes don't cause cancer. That is very clear. But let's just go back to the question that you posed, which is kind of this 21st century reality where there's an understanding of what medical doctors and conventional medicine does, and then there's another understanding about what wellness culture may do. There is not a single instance that I know, and I probably know hundreds of doctors where I've seen somebody go into it for, quote, the wrong reasons. Everyone is there because they want to help people get better. I have never once heard anything around, well, we want people to stay sick because we make more money. Now, that doesn't mean the incentive doesn't exist. And I think that if we start looking at larger medical systems and how hospitals are run and how the American healthcare system works, I'm a little bit less solid as to being able to say, these are all people who are aligned with improving the health of the American public. I think that the core idea here that I would tell people is conventional medicine trains people to manage people's symptoms and to manage people when they have gotten so sick that the only opportunity to do something about their problem happens in the clinic or in the hospital. And it does a really good job if a person gets appendicitis or if a person breaks their leg or if a person comes down with some crazy infection. You absolutely want to look at conventional medicine because that's where you get access to surgery, to antibiotics. Conventional medicine does a very poor job at preventing chronic diseases. But the thing that I want people to know here is I think the reason for that, yes, it's because the tools aren't available. Yes, it's because the training isn't as comprehensive. I mean, we get an hour, if that, of nutrition training, but it's because disease prevention is not an outcome of what happens in the doctor's clinic. And I'm going to say that again. Disease prevention is not something that we should rely on our doctors to give us because disease prevention is not a reflection of whether you do something one day or another day. It's a reflection of all the choices we make over decades. So when you look at the most common diseases of the modern day, whether that's heart disease or diabetes or Alzheimer's disease, these aren't one hit overnight issues. It's not you ate gummy bears today and you could have had a kale salad, so tomorrow you will or will not have diabetes. This is a compounding effect of decisions made over decades. And so it's also not just, eat this food and not that food. It's the exercise, it's the social interactions, it's the mindfulness and meditation. It is a sum reflection of the quality of the choices we make and the quality of our lives. And if you then look and say, well, can conventional medicine do anything about that? If you have a 15-minute visit with a primary care provider, they can check your blood pressure, they can check your cholesterol levels, they can ask you if you're depressed, and now the visit is over. They're not going to get to the core of what's going on in your life. What are the major limitations that are keeping you from prioritizing health as opposed to falling victim to a society where poor health is not just the default, it's kind of the goal of a lot of the marketing and a lot of the products we see today. And I want to say one more thing on that front. I think we all have to recognize that in modern society, and I'll speak specifically here to the United States because it's the society I'm most familiar with, we have set up a scenario in which poor health is the default and in which the incentive structure of companies, of kind of the entire society around us, is built around us not being happy people. And I think that's the fundamental issue with prevention, with health, is that if we are creating people whose brains are in a place of constant discontent. They will always be seeking solutions to get rid of that pain, that psychological pain. The solutions we are provided to get rid of that psychological pain make us sicker because it's the foods that we know lead to disease. It's the binge watching Netflix and scrolling on social media. It's the sedentary behavior. It's all of these things that we are being told are the solutions to our mental health issues that in the aggregate actually make things worse. And until we get to that, until we create a society where we prioritize something over GDP, what if we prioritize mental well-being? We will continue to see these outcomes occur. So to go back to your initial question, what does conventional medicine look like? There are a number of issues with conventional medicine. There are a number of issues with insurance reimbursement, with the way our hospitals are set up. And the incentive structure is not around health promotion as much as it is other things. But the bigger issue is that the American healthcare system is a microcosm of a society where health and wellness have never been the most important priority. So from that perspective, we should not be surprised when average lifespan the previous 2 years has gone down. We should not be surprised when so many people experience these preventable conditions, including mental health conditions, because the society is not optimized for that. That is not, to use some kind of company speak here, the OKR or KPI of the United States government. We have other priorities. So I guess what I would say is I don't think there's anything all that surprising here. And I don't think it's some sort of a global conspiracy. I think it's just that we've prioritized the wrong thing.
Wow. Yeah, that's really interesting, Austin. And I want to deep dive into what you would refer to as preventable diseases. It's interesting because right now, specifically in my category, which is the fat loss, the weight loss, the nutrition and fitness, you will get canceled for saying that obesity is preventable or even diabetes. And like, I used to say, as a Faster Way team and certified coach community and client community, we share a common enemy. Our enemy is disease. Our enemy is cancer. Our enemy is depression. Our enemy is anxiety. I had so many people criticize me for saying my enemy was obesity because in kind of this self-love movement of body
Mm,
positivity, it's like, well, it's okay to be obese now. And I'm like, no, I want people to be alive and thriving. So it's just a really 2024. It's like a mind bender. I'm like, I don't even know what I can say, what I'm going to be canceled for these days on the internet. But from my perspective, like obesity is preventable in many ways. And you got Oprah saying, no, it's not preventable. This is something that is just
mhm.
happening to us, and we should all do the weight loss shots. And this, so it's like it's a very just unique time. What, in your opinion, are the top 5 most preventable diseases? And then we're going to talk about the brain connection and some of the steps that we need to take in order to prevent them.
Well, I'd like to just address what you brought up because I think this is a very controversial but incredibly interesting point, which is the conversation around obesity. And I think there are two things that are true. One is blaming people for something that maybe they don't have the ability to change is not a good thing. But when we look at pure statistics and we see that the majority of people now are overweight or obese, and that even though BMI is anything but the perfect correlate of, a person's actual makeup, right? A person could be very muscular, still have a high BMI. It doesn't mean that they're metabolically unhealthy. There are a number of people who are overweight, even some who are obese, who are metabolically healthy. But by and large, people who are carrying more weight around specifically their midsection and visceral fat are at a higher risk of dying early, of developing diabetes, of developing heart disease, of developing depression and Alzheimer's disease. And I think at some point you have to say, well, what is the goal? And you can have that conversation with an individual. If that individual's goal is not necessarily to promote what we would technically define as health outcomes, but rather they just want to be comfortable, then that's up to them. That's their goal. But I don't think it is reasonable to say that we should normalize obesity as healthful. I mean, it gets back to a little bit of what I was referencing before, which is what are the incentives in our society? And it would kind of make sense when everything is geared towards people consuming and becoming unhealthy to say, well, there's nothing we can do about it. This is just what it is. Or the much worse version, which is the version that I see so many food manufacturers, cereal companies are notorious for this, say, which is, you know what, everything in moderation. Like eat our cereal with some healthy other stuff, and it's part of a complete breakfast. Or if you want to have that candy bar, it's okay in moderation, but it's up to you. It's your choice. And I really think the more that the United States, the world moves towards a diet, moves towards a society where poor health is the inevitable outcome, it's such an amazing cover to tell people, well, you know what? You actually shouldn't worry about that. You shouldn't worry that your type 2 diabetes is preventable. You shouldn't worry that your obesity is treatable without pharmaceuticals, because just wait until things get bad enough and modern medicine will solve it for you. That is not a sustainable long-term outcome. When you ask this question, though, about what are the diseases that are preventable, I do want to be clear, we're not talking 100% preventable, meaning there are some people with a genetic predisposition or something that happens in their lives that is going to be so significant that they will get a disease. But my belief is for the majority of people and for the majority of chronic diseases, they can do an incredible job decreasing their risk, if not completely mitigating their risk for most of these conditions. So what are these conditions? Well, certainly type 2 diabetes is at the
Hmm.
top of the list.
Yeah.
When we look at the knowledge as to how many cases could be prevented and reversed, which I think is really important, we see that the majority of type 2 diabetes is preventable and probably reversible to a certain extent with lifestyle intervention alone if people stick to it. There's some really compelling research specifically around ketogenic diet, around exercise, showing reversal of type 2 diabetes, people getting off of their insulin. This isn't science fiction. This is a real thing. Then we have heart disease and kind of cardiovascular diseases. So we have heart diseases in particular, like coronary artery disease. We have hypertension. We have stroke. And most of the risk factors for this are preventable risk factors because it's diet, because it's physical activity, because it's stress mitigation. So we know that so much of that can actually be prevented. And this is very standard stuff. I mean, this isn't going out on a limb here. Preventive cardiology is a field within standard cardiology. It's not just an integrative kind of modality. Then we could talk about the area that I'm most interested in, which is around brain health. And it is absolutely shocking that despite the science available, preventive neurology is really not a field. And so I happen to know probably the majority of, quote, preventive neurologists in the United States. And they're fighting this battle, which is that by and large, the way people approach the brain is they wait until things get so bad that they have to see a doctor. That's crazy. That would be like waiting until you have a heart attack to think about cardiovascular prevention. We wait until we have such bad depression, anxiety, or we're losing our memory. Or the one that I saw far more, which was the wife bringing in the husband saying, he's just not quite all there. And at that point, our ability to do things about the problem are so much smaller than they would be if we took it seriously from the start. So some of the top brain health conditions we now understand are significantly preventable. And I'm not saying, again, it's 100% preventable, but in the context of Alzheimer's disease, we know probably about 40% of cases, based on the most conservative estimates, are preventable with lifestyle. We're now understanding also that conditions like depression and anxiety with lifestyle may be preventable. And we have data showing from interventional trials that when you put people on the right diet, the right exercise plan, you can actually improve cognition even in people with pre-existing Alzheimer's disease and improve mood in people with pre-existing depression.
Wow.
So the point I'm trying to make here is there have historically been these silos, which is conventional medicine states that a disease is the sole purview of somebody like a medical doctor, where basically go out into your life, do what you're going to do, nothing can be said or done until you get a disease. And once you come into the clinic with the disease, we can prescribe you a medication. And that's the entire cycle. Maybe there can be a surgery. Then we have the other wellness space, which says that, we can do things that are not pharmaceutical, not surgical, across the continuity from prevention all the way through to disease. And so there hasn't necessarily been much of an overlap until more recently, where conventional doctors are now coming to terms with the fact that the data is so clear, specifically around diet and exercise, that we can prevent and potentially reverse some of these conditions and give people their lives back. So the the cornerstone, I would say, to it all is we absolutely have within each of us the power to prevent, significantly decrease our risk for the majority of the top killers and contributors to disability in the world. But it necessitates each of us taking agency over this and, in essence, saying, if I don't do anything, I will, statistically speaking, develop at least one chronic disease, statistically speaking, be on at least one pharmaceutical for the rest of my life, and statistically speaking, be at an incredibly high risk of losing my mind from a cognitive perspective. I mean, it's basically, if you get to over the age of 80, it's about 1 in 3 chance of developing Alzheimer's dementia. So if you accept that, that's up to you. If you don't accept that, then there's so much that you can do to decrease your risk.
Wow. Okay, this is extremely powerful. It's starting to get juicy, everybody. So, recently, I read a stat and I shared it in our certification information event that more than 300 million people worldwide suffer from depression. And this is a couple years old, so it's probably much bigger now, especially post pandemic. And over 40 million adults alone in the US struggle with anxiety. You are saying that depression and anxiety is addressable, is preventable with lifestyle choices. But even more profound, you are saying that dementia and Alzheimer's is addressable, preventable. It's really sad though, because I have several people in my life who have struggled with anxiety, depression, dementia, Alzheimer's, and unfortunately they will not change. And so for
Hmm.
everyone listening who says, yes, my parent who's advanced in years, my spouse who, just will not stop eating the pastries every day for breakfast, does not want to do any exercise. Like I know that, we have 442,000 faster way, clients, former and current. Many of you listening are saying, okay, I can't wait to hear all the answers, but my spouse doesn't want to change. My father doesn't want to. We can't do it for them. My father-in-law
Hmm.
will not start exercising at the age of 75 and stop eating
Hmm.
bread just because I say so. For 10 years I've been saying. And then, you're going to the dementia doctor and you're doing this and but they're not saying to change up your lifestyle. That's not what they're giving you a pill, or they're saying no, there's nothing
Right.
you do. So
Yep.
they have to want it is issue number one. And if you're listening and you can relate to me, where your father-in-law is just never going to change, your dad's just never going to change, your spouse is just like you, we can't do it for them. But if they are willing and we send them this podcast, or we ourselves, as we're continuing to age, we want to prevent. What are our top secrets? What are the top tips from a lifestyle perspective?
Yeah. No, you're so right. And what a profound statement, which is that I think everyone has been in this place of saying, I know what this person could do better. And I know this would work. And your options at that point are to say, well, I'm not going to do anything unless they come to me, or I'm going to do something. And we probably all had that backfire, which is, hey, so I see that you are struggling with this. Have you thought about X, Y, or Z? And they say, I can't believe you would say that. I'm so offended. And then they don't talk to you again for months. So I'm totally in agreement. I think, you can't change other people unless they want to change. What you can do, though, is model the healthiest version of yourself. And what I have found, which I'm sure you found as well, is at some point people will come up to you and they'll ask these questions and they'll say, hey, so by the way, what do you do? It seems like you're in good shape. It seems like you're healthy. It seems like you're caring for yourself. It becomes an atypical thing. And I think when you're younger, it's not as significant because people have a little bit more flexibility. So they're not all gaining weight. They're not all in a bad mental state. And it takes a little time for the years to go on and for people to realize, wow, there are real differences in people who prioritize their health and wellness compared to those who do what is typical. So I think going into a college and trying to tell people, hey, you really shouldn't be drinking all that alcohol because long term it's linked to worse cognition, you get laughed out. So, I feel great. My thinking is amazing. But let people get into their 30s, let people get into their 40s where they say, I'm having a little bit of trouble with my memory. And all of a sudden they say, oh, well, that person before said something about X, Y, or Z. What I find is it takes something for a person to care, and it takes psychological pain. And it takes getting over the threshold where you say it is more comfortable for me to do something uncomfortable than it is for me to stay in the discomfort of an action. So I would say, let's get into some of this. I want to talk about some of the actionables that a person can take today and realize that you, whoever you are out there listening, have the power for yourself to improve your brain function, to improve your quality of life. And that is enough. If you can model that for yourself, it becomes a model for the people around you. And they're going to say you're weird at first. They're going to call you crazy at first. They're going to say you're difficult at first because you're making these weird changes to your diet, because you're going for a walk as opposed to scrolling on your phone, because you're drawing a boundary and saying, I'm getting into bed at 10 o'clock as opposed to at 11 because it makes me feel and think better. And people will eventually come to you and buy in. It just might take a little while, but you're
Mm,
totally right. And I'm so happy that you brought that up.
yeah. Yeah.
I wanted to go back to the point you brought up around some of these brain statistics, because just for context, these are things that tend to be hidden all around us, whether it's dementia or depression or anxiety. As much as we have in the last decade kind of brought to the attention the fact that these things are happening, so many people keep this close to home because they don't want people to see the weakness that comes from specifically having brain specific issues. But it is all around us. So dementia right now, as you mentioned, we got 55 million people around the world, of which around 80% of those cases are Alzheimer's dementia. And the statistic that I want to bring up again, because this relates to everyone, is if you get to age 85, which we all should have a desire to get to age 85, but in a healthy way, if you get to age 85 right now, there is a 1 in 3 chance that you will have Alzheimer's dementia. That is an absolutely horrifying statistic, which tells me that I can't be an average person when I get to age 85, or I have a 1 in 3 chance of having lost my cognitive abilities. When we look at mood issues, right now, it's about 21% of American adults who have had a mood issue in their lives. But around 13% of adults in the United States have used antidepressants in just the last 30 days. And when you look at women over the age of 60, that number goes up to almost 25%. So the core statistics here, I mean, these are just talking about pharmaceuticals and rates of two conditions related to the brain, are absolutely stunning, because what it tells us is, again, if you don't make changes, if you kind of go along making the same decisions that other people around you make, if you go to any mall in America, if you get on a plane and you look around and see the people, it's kind of like that scene that never happened in my class, but people always talk about, which is look to your left and look to your right. In 5 years, one of these people won't have made it. This is what we're talking about. The average person in the modern world, and I use America as kind of the base rate here, but these statistics apply to basically every other country. The average person is going to develop a brain issue. Now, coming back to what you said before, you have two options here. One is to say, I have enough data, I care enough, I want to make the choice now. The other option, and this is a very binary system, is you say, not yet. You say, it is not concerning enough to me right now. I have to wait until my family member develops Alzheimer's to say, oh my God, I don't want that. Or I have to wait until my mental health is bad enough that I need psychotherapy and an antidepressant, because right now I don't care enough. That's the usual way of doing things. So the goal here is to say, what is it that you care about the most? And I've asked so many people this question, and it's funny because people start with a whole bunch of other things. Oh, I want to have $1 million. Or they say, what I really want is this new house. And I say, well, why? Why? And if you eventually ask why enough, you realize it's because that's what I think is going to make me feel good, what is going to make me feel happy. And you say, okay, so you want to feel good, you want to feel happy. What does that mean? And what it means is you want your brain to be in a good state. So forget everything else and get to that and say, if you want your brain to be in a good state, what do you need to do to make that happen? And often it has very little to do with the things people are most concerned with. The other thing I just say here is just like a relationship where you think, oh, well, I have this partner. I want them to like me. I'm just going to buy them a bunch of stuff. That doesn't lead to a sustainable, happy, long-term relationship. You've got to be thinking about investing in the actual relationship and the health of the individuals in that relationship. And I look at the brain as the lifetime partner. You know, everyone has these romantic partners over the course of their lives, or I should say most people do. They may come and go. If you live to an old age, like 85, you'll probably have lost at least one romantic partner, but you won't have lost your brain. Your brain is with you the whole time. And so if you're enjoying your brain's company, if you're able to use your brain to think clearly, to feel good, that is the single most valuable relationship in your life. And if you're not investing in that relationship each day, you have a very high likelihood that you're not going to be in a good place in that relationship. So
Mm.
I'm obviously quite biased, but I think this is the single most important thing for everyone listening to pay attention to, because if you can get your brain right, everything else will follow. And the good news about how to do that is it's a lot of these pathways that people have heard about before. It's improving metabolism. It's improving inflammation, specifically decreasing inflammation. So these are things that we know we can act on with dietary strategy, with exercise strategy, with stress mitigation, with sleep. We can talk about some of the very specific nuances and where I'd kind of recommend people begin, but realize that this is all within the domain of what you can control each day. And so you are the best chance of developing that relationship, that brain that's going to last you for your lifetime in a really positive way. And that is the most important thing in our lives.
Yeah. Wow. The relationship with your brain or supporting a healthy brain on a daily basis is absolutely key. Uh, in the faster way, we prevent and address inflammation with a gluten free, dairy free food log. We focus on whole food nutrition. We leverage carb depletion strategies with carb cycling. Some days we do lower carbs, similar to a keto type lifestyle. Other days we do higher carbs, depending on the workout and so forth. We exercise 30 minutes a day, really effective workout. So we know the foundational concepts for a healthy lifestyle. We drink water, we sleep. What are maybe two or three secrets that you have that are not just the standard? Because we're familiar with kind of the most standard tips, but is it a supplement? Is it a certain food you're like, oh, you got to eat XYZ? Like, tell us something that maybe we don't know that's beyond the scope of what we're already doing in a faster way.
Sure. I mean, let me give you a really good example. Research now shows that consumption of creatine monohydrate can improve cognition, and especially improves cognition in people who are older, potentially more so in women, and people who have a diet low in animal protein. It's a hack,
Yes.
right? So creatine monohydrate is one of the forms of creatine, and it's been consistently shown to be correlated with better brain function. Why is that the case? Well, it seems like it actually enhances brain metabolism. So very basic one that I do, 5 grams a day, creatine monohydrate. I think it's one of the best studied supplements as it relates to brain health.
Oh my good. Okay,
Quick app.
Dr. Austin, you could see I was like about to jump out of my chair. So we have a scientific advisory board member, Dr. Bill Campbell, who is the leading researcher on creatine. And
There
we
you go.
actually launched our own faster way creatine recently and have been really diving into the science behind creatine. So I want everyone listening to hear Austin. He said creatine is proven to improve brain health. Proven.
And we didn't plan this. There's no
We
financial
did
incentive for me to make
not.
that claim, but it is one of those things where, we actually do have a decent creatine's been used for many years. It's part of our diet, but what's really interesting is that we know we can raise concentrations of creatine in the brain, and a study just came out showing that in people who were cognitively depleted, so they had them sleep deprived, that it showed significant benefit to their brain function. And I think that's really the interesting thing is it seems to regenerate brain energy, and we don't really have many things that seem like they do that. So creatine is one hack. Let me give you another one as long as I'm on the subject. So specific to inflammation and inflammation in the brain, something I've been talking about a lot recently is the hidden, I guess, dangers, toxins we bring into our homes that can, in essence, program our brains towards worse health. And I usually think about risk for Alzheimer's and cognitive decline and depression as kind of the two main surrogates for general brain health. Incense, and I may be offending people here. Incense is one of the most concentrated sources of indoor air pollution that people can use in their homes. Now, I don't know, Amanda, you may also have an incense product,
No,
and
I
if
do not.
so, I'm sorry because I'm sorry because I'm going to be offending people
I
here.
don't.
But when you look at what incense is, it's been used for thousands of years in religious ceremonies and other rituals. But what you're in essence doing is generating an incredibly concentrated source of particulate matter, specifically these PM 2.5s. PM 2.5s have been strongly linked to the development of Alzheimer's disease. It's actually thought to be one of the top risk factors for Alzheimer's disease
Wow.
and impaired cognition in general, as well as depression. And what's really interesting is you can see that some of these effects happen very quickly. So we're not necessarily talking about decades, that these particulate matter, when we inhale them, seems to decrease our short-term cognitive ability. So the hack here would be to not burn incense in your home. And if you do decide to burn incense in your home, I would say limit how much you use. Make sure you're using it in a well-ventilated space. So open windows, air purifier, and just consider that anytime you see smoke inside of your house, that is probably one of the most significant contributors to worse brain health that you could have. So incense is probably the worst one, but if you have a candle that's putting up a lot of smoke, you need to consider that. And it might be as simple as trimming the wick. But these are little things that actually add up pretty significantly. And again, some recent research demonstrates that in even a short period of time, exposure to these concentrated sources of indoor air pollution are linked to worse cognitive ability. And maybe especially interesting for your audience, we're now understanding that these sources of air pollution may contribute to weight gain by virtue of their signaling through inflammatory and metabolic pathways. So this is the hack that nobody's heard about, which is if you're trying to lose weight and keep it off, you really need to be thinking about the quality of the air that you're breathing. It's not just what you consume through your mouth. It's not just the calories and the other pathways you're using when you exercise your body. It's actually what you inhale that can have a huge output on your body makeup and composition. So
Wow.
those are two.
Okay, really interesting. I have a girlfriend who's trying to lose a significant amount of weight, and she's like the candle queen. So I am going to text her right after this. That's really interesting. I don't really burn candles, and I'm not an incense girl, but I know plenty of people who are or have been. So creatine, I think that's key. The incense. Tell me the worst food I could possibly eat if I want to maintain a healthy brain.
All right. Well, again, everyone has their ideas on these types of things. What is the worst, the best, the hacks? What I would say is, you get, I think in a given day, the average person eats about 4 pounds of food and drinks about 2 to 4 liters of fluid. So there are a lot of opportunities in there to make good or bad choices. And really what we're talking about in general is it's the aggregate of diet that makes the most kind of, or has the biggest impact on health, including brain health. But I would say if we're going to look at one group of foods, and we'll start there and then we'll get to a specific type of food, it's ultra processed food in general. So if it is something that humans have messed with a lot in terms of it's been ground up, it's been reformulated, it's been added into some sort of a mixture, there's additional flavors and sugars, those are the things in general to avoid. And I think it's a really helpful first place to start, which is to say, how much has this been processed? Is there a complicated ingredient list? And if the answer to the first one is a lot, and if the answer to the second one is that the ingredient list is complicated, that is something worthy of avoiding. But when we look specifically at the impact of specific foods and what has been most strongly correlated with negative brain health outcomes, the most consistent is sugar sweetened beverages. And so sugar sweetened beverages, it's a large group of drinks. They can be sweetened with things like sugar, so glucose, fructose, high fructose corn syrup, There are tons of ways that we can mask the name for sugar.
Hmm.
But these are some of the most popular drinks on the market. And so this includes energy drinks and coffee drinks, definitely sodas, it's in teas, all sorts of different beverages. And when we look at the research, about half of adults in the United States are drinking these beverages each day. And so when you look at youth, it's actually 63% of youth are drinking these sugar sweetened beverages each day. What we know is that these sweetened beverages at kind of a more macro level are correlated with a number of negative health outcomes and dysfunction in pathways. So, for example, children and adults who drink more sugar sweetened beverages have higher weight gain. And when we take away those sugar sweetened beverages, they get weight loss. And so when we look at individual conditions, um, for every, I think, 250 milliliters consumed of a sugar sweetened beverage a day, one study showed that risk of diabetes increased by 15%. So what we see there again is kind of in the context of metabolic dysfunction and overall issues that sugar sweetened beverages are problematic. We know that based on the results of a 2012 meta-analysis of 72 studies, consumption of sugar sweetened beverages is linked to stroke, hypertension, and general death from vascular diseases. But where we started was, how do sugar sweetened beverages impact the brain? And here what we see is that higher consumption of sugary beverages leads to an increased risk of dementia. They are leading to an increased risk of depression. So there was a study that showed that drinking 3 cans or so of soda a day may increase risk for depression by 25%. And the pathways here, again, metabolic, inflammatory, there are a couple of others, but really that's the main ones to think about. So I would say, as it relates to the single worst food for your brain, it is sugary beverages. And rationale here, if you just want high level, is when you consume a beverage, you're not getting any fiber. You're really not getting much of any nutrients. I mean, there are some that can be beneficial. For example, in coffee and tea, you can get these polyphenols that actually may have a metabolic benefit.
Yeah.
But the sugar itself in these beverages gets directly absorbed, spikes blood sugar levels. And why people think it's so concerning is you have no buffer. So there's no actual food matrix that helps offset that blood sugar effect. So if you're going to stop doing one thing in order to protect your brain, I would say cut out the sugary beverages. And we can talk about sugar alternatives, but I think the core idea here would be, if it tastes sweet, that is a drink, generally speaking, to avoid. And it's a hard move for many people to go to black coffee, or it doesn't have to be a black coffee. You can add dairy if you can tolerate dairy, but or dairy alternatives. But the point being, if it tastes sweet, that should be a big signal for you that it is bad for your brain.
Wow. Wow. Thank you for those tips, Austin. They were very valuable, and especially the creatine tip. You could tell I was pretty jazzed about that. Austin, thank you so much for taking the time. Where can we find you online?
Sure. My website is austinperlmutter.com, and I have a newsletter that I send out to about 120,000 people. So austinperlmutter.com/newsletter.
Great.
Other things people can do if they're interested, I'm running a study looking at how nutrients in plants impact immune function through a
Hmm.
company called Big Bold Health.
Great.
And you can find me on social at Dr. Austin Perlmutter if that's your thing.
Dr. Austin Perlmutter. Well, we truly appreciate your wisdom. And again, our Faster Way family, we know a lot of these tips, but we need to continue to keep them at the top of our mind. And then as we are models, our family will start to see and imitate. Our community will start to see and imitate. So everyone, let's continue to be a beacon of light within our communities. And we wish you all the best as you focus on your brain health. Thank you, Austin.
Thank you, Amanda.
Bye, everyone.